The effects of emotions on dreams was one of the first to stand out in methodological studies. When a predominant emotion is experienced during the day, it is significantly more likely for the core of dream content than we would expect from chance, and this core peaks about 6 nights later. Various brain cell processes involve reactivating recently activated connections. So this captures fragments of waking life and most strongly captures the emotional core. Also, interestingly, when sleepers are experiencing emotional overload in their waking life, they are most likely to experience early REM onset, more REM sleep overall, and more rapid eye movement during REM sleep. Knowing how emotion affects dreams caused Rosalind Cartwright in 1998 to wonder how an emotional life event like recent divorce might affect dreams in particular. She compared dreams of recent divorcees to those of non-divorcees. Besides finding the hypothesized early onset REM, more REM overall, and more rapid eye movements during REM sleep, she found increased dreams of misfortune with overriding themes of blame and psychological impotence, the inability to do even simple things anymore. Additional evidence that dreams reflect our waking lives comes from cultural effects on dreams. People in the United States tend to dream about cars and homes, and their dreams are populated by others dressed like their friends and neighbors. The dreams of people in small, primitive societies, in comparison, tend to contain huts or tents and oxen or yaks, and are populated by people dressed quite differently than Americans. There are even socioeconomic class effects on dreams. Although misfortune is a common theme across all dreams, the dreams of lower classes contain even more misfortune than those of their upper class counterparts. Pregnancy has significant effects on the dreams of moms and dads to be, especially the first pregnancy. However, as you may have guessed, dreams are affected by the emotional components of becoming a parent rather than physiological ones. During early pregnancy, women report more of miscarriage and intrusive and/or dangerous fetuses. No worries, this is actually quite common. While dads tend to dream more about masculinity versus nurturing concerns during this time frame. As the pregnancy progresses, both moms and dads to be tend to dream more about the baby, mothers more about possible abnormalities in the baby, and their relationship to one another, and their own and their partner's anticipated parenting skills. Note that women report more dream recall as the pregnancy progresses, but they don't actually dream more. Can you guess why? You might recall from our discussion of how pregnancy affects sleep that pregnant women awake far more often, thus remember more of their dreams. Although pregnancy is a significant life event and divorce can be quite stressful, the word trauma is more often reserved for life-threatening events like rape, repeated abuse, being a target of warfare or terrorism, or witnessing others in such a situation. Trauma is defined as a significant amount of stress that exceeds the ability of the mind to cope. Trauma victims commonly experience nightmares, both reliving the trauma and with other terrifying and vulnerable content. Over 10,000 people in New York City have been treated for nightmares after witnessing people jumping out of the towers on 9/11. Often the nightmares go away over time, suggesting that these nightmares can be functional in that they provide a safe space similar to clinical therapy for dreamers to work through trauma. By the way, if they don't cease over time, it may indicate PTSD, which requires additional treatment. We'll look at nightmares further when we explore the functions of dreaming in a later section of this class. So, there are many examples of how our waking life influences our dreams. But dreams have proven to have impressive immunity in another regard, and we'll explore this in our next segment.